minerals, supplements, vitamins. What do we do with all these products that we're taking right now? Do they really make us healthier, or is it just a marketing scheme? Let's hear it from the team. What we put together. This is actually an important video, a very hard one to do, but I'm going to show you where we are today in this area. Take it away.
Yeah, a very great introduction from Dr. Curnew. Today's discussion is going to be on vitamins and minerals. We want to try to answer the question, do they make you healthier? Do they work? Do they not work? What is today's literature telling us? So if we go on to the next slide, we'll discuss some of the things we want to talk about. Of course, we're going to first talk about what are supplements and minerals. We want to talk about what does the science say surrounding this topic? What are some possible health risks regarding the use of these vitamins and minerals? What is the role that it might actually play in benefiting those who are considered high-risk groups? We want to then talk about how it's important to get your nutrients through your diet, and then conclude with wrapping up our discussions on vitamins and minerals after we discussed everything we want to talk about. So on the next slide, we have some 2 pictures from this week that Dr. Curnew would like to briefly introduce.
There is Elizabeth. She's a lady in her late 80s who came to the clinic, brought me a McDonald's coffee with milk, and brought me some soup. And I would argue is that if we go backtrack, she is one of these people that who's in her 80s, her immune system is not as strong, but who's had stroke, but whose willpower is stronger than most people I see. She an amazing lady. She brings me soup, and she brings me homemade soup full of nature's antioxidants. You're going to hear some stuff from Aditi here, and she does our nutrition webinars. And one of the things is that, and others have given me, add kale to my soup and broccoli to my soup. That actually gives me a fair bit of calcium, for instance. I don't want to take pills. I want to take real Mother Nature. On your right is some of our superstars. Now, one of the things is that these young people have a good, strong heart and a good immune system. Look at this for many of us. When we were in our early 20s, we were at peak efficiency for our immune system, our cardiovascular health. And afterwards, it's downhill for most of us. But we can do something to prevent us decaying right now. And Elizabeth is a great example of somebody who's been a second mother to myself, an individual that has made a huge difference in so many lives in her nursing career, and now in her work and her support to us right now. On the right are these young superstars that are taking over the world, strong immune systems, and these people have changed the world. And I thank them all, and we should be grateful for both the young and old. And this brings us, how do we protect an older generation and allow a younger generation to live through what we're going right now? And I'll show you some ideas how we do that better. Next slide, please.
Yeah, so I want to very briefly introduce something that's happening in the world right now. As we know, the Olympics is a very timely topic of discussion. The Olympics obviously has a wonderful ability to bring people together. It can be really exciting for us Canadians to root for our world's top athletes, regardless of really what country you're from. In a recent hockey game, actually, between the Canadian women's hockey team versus the Russian Olympic Committee women's hockey side, there was actually a significant delay. And this was because the Russian side were unable to submit their COVID test results prior to actual puck drop. This led to a really lengthy delay to over an hour. And for many of us who maybe wanted to stay up and watch this game, we might have went to bed because it led to the game being delayed to after 12 o'clock, which is midnight for our time. But while we were sleeping, the game went on. In abundance of caution, while we were sleeping, the game went on, and both sides actually went on to play the game with full masks. The Canadian women's side went on to win the game 6-1, and it really made us at the clinic sort of think of maybe some of the polarity that we're experiencing right now in the current state of the world and the pandemic. Of course, there's a lot of opinions surrounding what is best in regards to mandates, vaccinations, what the implications are regarding public, community health, or our own health. What we do know, and what we've talked about in different webinars, is looking into the research on vaccines, social distancing, masking, recognizing how important they are for preventing you from getting sick. But likewise, there is really a lot of opinions surrounding the use of vitamins and minerals. And so just as we would like you to make informed decisions regarding your health when it comes to the COVID-19 pandemic, we wanted to spend some time today looking into the literature surrounding this topic of discussion, vitamins and minerals, to make sure that you are making decisions about your health that you feel informed and get all your questions answered today.
Now, before you change slides, this is the best moment of the Olympics to me. We have the women's Olympic hockey team who stayed in their bubble, all vaccinated, and played hockey with N95 masks or K95 masks or equivalent. Amazing. And so one of the things is that masking right now, masking goes through evolution. So this is just a regular surgical 2-ply mask. This will help spread disease. So if I have COVID, I will spread less disease to other people and less of the anything that's aerosolized. So things like pneumococcal pneumonia, influenza, this will make a difference. This is a K90, I'm sorry, this is a K95 mask, and it's 3M1860. This is the mask that has been fitted to my face to provide a total seal. So this is the mask that I wear when I'm on a COVID ward or I'm in a high-risk situation. So if I'm traveling on an airplane, if I'm in around a lot of people, I should wear an N95 mask that is fitted to me. At one time, I had a beard. I have to shave my beard because the hair will get away. They'll be they won't get tight seals. This is a proper seal. Now, these masks can be worn up to 25 times. So we don't have to throw away the mask the first time, but I recommend right now is you wear this mask when you don't want to make somebody sick. And if you're in a high-risk situation, you wear a mask that's properly fitted as possible, or an N95 mask or a K95 mask. And the Canadian hockey team just shows me what's possible. Hardworking individuals, success is hard work. They even practiced with N95 masks or K95 masks. And today, someone came to the clinic today and said, well, you know, I feel uncomfortable wearing a mask, was wearing it below her nose. I basically said to her nicely for the third time, please wear your mask properly. And then I rose a little bit. I said, don't yell at me. I'm saying, you need to wear this mask so you don't infect others. And that's really important. So you have to decide if you want to help others and help yourself right now. So I think masks are important. And the Canadian Olympic hockey team, the females here, thank you for being Canadian. Next slide, please. Supplements.
Yes.
Go ahead, Didi.
Yes, so we're going to start by talking about what supplements are. This is the topic for our webinar today, so it's important to kind of understand what we're talking about. So dietary supplements is commonly what you might hear, and this is the umbrella term that encompasses vitamins, minerals, and other botanical or biosimilar ingredients. So those can be kind of synthetic compared to what we would naturally get from diet or food, things like that. And the main things that we think about in terms of dietary supplements is vitamins and minerals, as this is typically what people will tend to take. So in this little image down here, we have a whole bunch of little happy vitamins and minerals dancing, and these are common things that people will take. So things like vitamin C, iron, B12, vitamin D, and calcium. And then Dr. Curnew, would you like to talk about the picture of yourself with all the vitamins?
Yeah, so I have in front of me is that I'm in my early 60s, and someone suggested I take a vitamin supplement for those over the age of 50. So do I get value for that? And so that's in my right hand. In my left hand, I have atorvastatin 80 milligrams a day, or sometimes I take rovastatin or Crestor 40 milligrams a day. Where do I get more value for it? And well, my perspective is I'll let you decide to do about the vitamins, but atorvastatin 80 milligrams a day, or rovastatin or Crestor 40 milligrams a day, if I take it for 5 years or greater, will lower my risk of having a heart attack by 50%. On my sheet is omega-3s and other vitamins and supplements. In that corner is Visipa there. What should I take? And so let's explore this right now. So I'm left-handed, and my left hand is a high dose of a statin, and that halves my risk of having a heart attack or stroke. There is some observational data that people who take statins have less heart attacks or less COVID infections. That quality data is not as strong, but I'm taking a cholesterol pill to prevent a heart attack and stroke, and it works. If I should do it, you should think about it, whether or not you should as well. Next slide, please.
Yes, so now that we've kind of talked about what dietary supplements can include, let's dive a little bit deeper into what vitamins are. So vitamins are organic substances that are either fat or water soluble. They are essential micronutrients, so we do need to obtain them from our diet, or the other form is supplementation, which we'll discuss a little bit today. So for the fat soluble vitamins, you have vitamins A, D, E, and K. What's important to note about these vitamins is that they dissolve in fat and therefore have the ability to accumulate and be stored in your body. So that's something to be really cognizant about, especially if you are using an external supplement for any of these vitamins, because they do have the ability to accumulate in your body. For water-soluble vitamins, these are things like vitamin C, B12, B6, B-complex, and folate. These cannot be stored in your body as they need to be dissolved in water in order for your body to actually make use of them. So for common vitamin supplements that someone might take, we often hear of B12 or B-complex, folate, vitamin D, vitamin E, vitamin C, or biotin. So what do these vitamins do? So for vitamin A, it's required for vision. It's also required for healthy skin, maintaining mucous membranes. It's a key player in mucosal immunity, bone growth, immune health, and the precursor to vitamin A is beta-carotene, and we'll be discussing a little bit more about beta-carotene in the upcoming slides. And then for folic acid, it's part of an enzyme that's required to make DNA and new cells. So it is required for many individuals. However, you've probably heard that folic acid is extremely crucial in pregnancy, and that's, again, something that will come up in the upcoming slides. Next up is B12. So B12 is required for making new cells and nerve function. So having adequate levels of B12 is especially important. If you do have a deficiency in B12, there is a risk for potential nerve damage. So making sure you have adequate levels of that is extremely important. Now for vitamin D, that's required for proper calcium absorption. So if you are deficient in vitamin D, your calcium is not going to be properly absorbed. It also regulates the contraction and relaxation of blood vessels and muscles. For vitamin K, it's required for proper clotting. It helps make 4 out of the 13 proteins you need for blood to clot, and this allows it to stop wounds from continuously bleeding and allows them to heal. For biotin, this is a vitamin required for energy metabolism. And finally, for vitamin C, it's an antioxidant. It's required for protein metabolism, immune functions, and it aids in iron absorption as well. So now on to minerals, the counterpart to vitamins. So minerals are inorganic elements. They're usually found in soil or water, and then it tends to be absorbed into plants or consumed by animals. So common minerals include things like calcium, sodium, potassium, iodine, copper, and zinc. So you have some essential minerals, and then you have trace minerals as well. So what do these minerals do? Well, sodium and potassium is pretty much involved in most bodily processes. It's required for proper fluid balance. It's required for nerve transmission and for muscle contraction. Calcium is not only required for health. Calcium is not only required for healthy bones and teeth, also required for muscle contraction and relaxation, nerve function, blood clotting, blood pressure regulation, and immune health. Magnesium is required to make proteins, muscle contraction. It's required for nerve transmission and immune health as well. And then finally, iron is part of hemoglobin, which is found at the center of your red blood cells. This is the oxygen carrier, so it's essential for that function. And for zinc, it's part of many enzymes. It's required for making protein and genetic material. So all of these vitamins and minerals have essential functions within our body, and that's kind of why it's important we consume them. So for vitamins and minerals, you can get them from dietary sources, but people still tend to take supplements. So why exactly is that? So a 2017 survey in the Journal of Nutrition found that 70% of the older adults surveyed took at least one supplement, 54% of them took 1 to 2 supplements, 29% took 4 or more supplements. And because vitamins and minerals have a wide range of immune and health benefits, people often believe that having that extra vitamin supplementation is going to benefit them in the long run, which often leads to people taking a wide variety of over-the-counter supplements. However, it's important to note that supplements are not a replacement for a balanced diet, and we'll talk a bit about the dietary sources of some of these vitamins and minerals towards the end of this presentation. Additionally, there is not enough evidence to support the efficacy of certain supplements, and over-the-counter supplements additionally are not effectively regulated. So that also brings in another layer because there's not as stringent of regulation compared to perhaps like a drug that you might be taking that you would require prescription for. And as a result, it's really important to be cautious if you're choosing to take an over-the-counter supplement.
So vitamins, if you go back, we'll say is that they're good for the prostate, good for your health, good for your vision. It didn't say it actually proven to help you. It said good. I'm not sure what good means. That's not a good scientific word. They show people being healthier. There is actually some data, if you have cancer, a lot of people go to supplements, is that cancer cells are rapidly dividing cells. And if you feed them with vitamins, you actually might increase the chance of cancer coming back. And so I think this is really, really sad that we have so many people taking all these supplements in the hope that they'll do something. And most of that, unfortunately, is false hope. And we'll talk about that more as time goes on. You point out is that Mother Nature has evolved over millions of years and it has gave us a game plan for healthy life. Taking ingredients out of the soil, out of food, and putting them into a pill is not a good substitute for a healthy life. But we'll talk more about that. More to come. Let's hear more, Aditi.
Yeah, so now we're going to go over the recommended daily or dietary allowances. So this is the amount you should be kind of aiming to hit within a day for different vitamins and minerals. So for vitamin A, for males 14 and above, it's 900 micrograms per day. For females, it's 700. For vitamin D, we're talking for people, for males 14 and above, 600 units, same for females. For vitamin C, it's 90, and then for females, 75. Folate, 400 and 400. And then vitamin B12, it's 2.45 micrograms per day for both males and females over the age of 14. And then for nutrients, for something like magnesium, males will need 400 to 420 milligrams a day, females 310 to 320 milligrams a day. I point out magnesium here because it's actually one of those minerals that has an upper limit that you're not to exceed, and that's 350 milligrams, but that's from supplements only. When you consume things like magnesium in diet, you're consuming it alongside a lot of other things, and your digestive process has a way of kind of extracting the magnesium at like a safe level. When you're taking supplements, it's just like a concentration of magnesium that you're taking. So it's recommended that you don't exceed that upper limit. And then finally for calcium, all adults require about 1,000 milligrams per day.
So what's interesting is that there's some concern that taking calcium supplementation may increase the risk of having a heart attack, where when you get calcium from food, you don't see that increased risk. So lots to learn about this. And again, I love Mother Nature. And I worry about what people are doing sometimes. Go ahead.
So at this moment, I'd like to first break down what is really important to do before we discuss vitamins and minerals, and that's understanding how to interpret literature. Because before we dive into what the literature is saying, it's important to have at least a preliminary understanding of how to recognize what is good quality literature and what is perhaps bad quality literature. So on the next slide, you're going to see right here, which is a pyramid. This is a pyramid called the Hierarchy of Research Design. This pyramid really lists all the different types of research designs in order from the weakest level of evidence, which starts at the bottom, you can see in purple, all the way to the top, which you see leads up to randomized control trials, meta-analysis and systematic reviews, and finally clinical practice guidelines to inform the way healthcare providers are able to use the information that is in the research study. And the strength of the evidence is based on the ability for these designs to control for a lot of biases inside the study and to demonstrate cause and effect in humans. Of course, that's what the research is for. So when it comes to interpreting the science behind vitamins and minerals, we need to make an important distinction between observational studies. If we click once, you'll see these examples, that being the cohort and case control studies, and the randomized control trials, which you can see at the very top here. So if we go on to the next slide.
So if you just backtrack a little bit back, oh, okay, I'm sorry, go ahead, Stu, I apologize, go ahead.
Yeah, no, I was just wanted to say it's important to differentiate between, if we just go back really quickly, case control and cohort studies, which are lower levels of evidence. They have a lot more difficulty controlling for bias. And then when it comes to randomized control trials, often they're more considered the gold standard because it allows for possibilities to control for a lot of biases. For example, you have randomized controlling between the treatment arm or a placebo, which is essentially just a sugar pill or a water pill or something that doesn't actually provide benefits. And that way you can have a direct comparison between the treatment arm and someone who doesn't actually have the treatment. And the really great thing about randomized control trials is it's eliminating bias by completely blindly randomizing people into one group or the other. So that really does eliminate a lot of the internal bias, which allows for the evidence to be something you can feel confident about by the time that you actually get that finished product or by the time you finish the study. Go ahead, Doctor.
If I can give you a couple examples of this. So we'll say is that we understand animal experiments. We know what happens in animals doesn't always happen in humans. We have to decide about the ethics of whether we want to do experiments in animals, but we're not going to enter that today. A case example is that my next door neighbor told me that taking vitamin C will make me live longer. That if this pill is going to cause you a side effect, you should take this supplement. You should do whatever. So that's just it's an example. It is prone to bias because for instance, I have a bias that I spent 30 years of my life researching working in cholesterol. I think cholesterol pills are very good. My bias is cholesterol pills are very good. Where you might feel is that I prefer natural substances and therefore cholesterol pills are bad for me. I should be able to do these things naturally. The way to solve that problem is to do a randomized controlled trial where myself, I don't know if you're taking a real pill or a fake pill. The patient or the individual doesn't know if they're taking a real pill or a fake pill. And the people that are analyzing the data don't know if you're taking a real pill or a fake pill. So that's called a randomized controlled trial, a double-blinded situation, and that's the gold standard for all research. We all have our influences, and and trials are designed a certain way to maximize benefit or harm depending on how you want to do this. So that's why we need to be very careful about the level of evidence. So when you say my next door neighbor, my pharmacist, or my friend told me about this, that's basically a case report, or you can make a case series. It certainly provides information, but it's not the same thing as a good quality randomized controlled trial that looks at solid endpoints. So please think about this from what you're doing. And fortunately or unfortunately, physicians, healthcare providers are taught to understand this type of information. And it's confusing for the average individual because that's why we are spending billions of dollars. And what influences you is happy people taking a supplement or a vitamin appear to be healthier. That's not a scientific experiment. That's just marketing. Next slide, please.
Yeah, so on this slide, we just wanted to divide between what is observational, as Dr. Curnew was talking about, versus what is better research, which is randomized control trials. So really, what is observational research? Well, this is basically researchers observing the effects of whether it's a risk factor, a diagnostic test, or a treatment without trying to change it or influence it in any way. So really what this can be is they're either deliberately selecting people who are exposed to something or they were not exposed to something, or they're randomly selecting a sample and then categorize them as exposed or not exposed. Really, one example which I learned in epidemiology, which I always found is really interesting when it comes to observational trials is, well, we know that the rates of burglaries, for example, go up in the summer a lot more than they are in the winter. And if you were to go back and take a look at what maybe could be some possible reasons, one reason might be that, okay, we've noticed that people eat a lot more ice cream in the summer than they do at the winter. This is an observation. This isn't necessarily evidence, but you can see how maybe someone can make a correlation between someone who's eating more ice cream, and then you're seeing that the rates of burglaries also go up in the summer as well. Of course, we know that there's no connection between the two, but that's how there's some issues when it comes to observational studies. It's that you are not actually controlling any of these factors, so it's very easy for you to maybe make a connection to something which doesn't necessarily exist. And for that reason, it's not as good evidence as something that is randomized, where you can control a lot of the factors. You can control who's getting the treatment and who isn't, and you can control all the factors moving forward in the study to ensure that you come up with a result that you can have confidence in.
So if you carry this, you can say that ice cream causes burglaries. Mm-hmm. And obviously that would be a wrong conclusion.
Exactly.
That's just observation. what you have to do as an experiment is randomize people to eat ice cream versus non-randomized to eat ice cream and see if that makes a difference or not. So that's a much different circumstance. My favorite observation is that unfortunately, most of us die in beds, but beds don't kill us. So I don't see beds eating people. So those are a couple examples. Thanks for sharing that. So I better watch that ice cream story a little bit more.
Yeah, as Dr. Curnew said, there's not definitive proof that the exposure is causing the outcome. So it's very possible that there may be many other factors. In Dr. Curnew's case, it could be lifestyle interventions, for example, that is aside from what you originally thought it was, which was beds, that may be contributing to that outcome of interest, which is, of course, death. And so as you can see, that's why observational trials aren't as great, and we're going to talk about what is a little bit better on the next few slides. Before we do that, we do have an echocardiogram, and I did want to pass it over to our expert here, Dr. Curnew, to provide his interpretation of what is really going on with all these squiggly lines.
So this is actually an ECG, and you see on that arrow is called a PVC, premature ventricular contraction. So unfortunately, this is a person who had normal heartbeats, then had an extra bad heartbeat that triggered a life-threatening rhythm problem that can end that person's life. So one of the things we know that PVCs are premature ventricular contractions are in the ventricle of the heart, and that can lead to sudden deaths. And one of the things early in my career is that why don't I just get rid of the PVCs? Why don't I have drugs? And we had drugs that can suppress 80% of PVCs. So therefore, if I suppress the PVC, I should suppress sudden deaths. Next slide, please. Logical thinking, very reasonable. So to find out for sure, if I just, and I did this early in my career, is that, and a lot of us did that as well, because we had clinical trials that showed that drugs like enconide, flecainide, propafenone can suppress 80% of PVCs. And therefore, suppression of PVCs with this drug, one of my favorite drugs was called flecainide, that therefore I can prevent you from dying suddenly. It wasn't until a randomized controlled trial was done where, again, patients who had bad hearts, who had lots of PVCs, were randomized by a computer blindly to either a real pill or a fake pill, and the investigators were blinded. Next slide, please. And what happened was in about 1990-something, 1970-something, the CAST trial was done. It was called the Cardiac Arrhythmia Suppression Trial. This was a randomized controlled trial of 743 patients that were randomized to placebo, and another 750 patients or thereabouts were randomized to antiarrhythmics such as enconide or flecainide. And back then, my favorite drug was flecainide. I used flecainide, and it showed that if you were randomized to flecainide, you had a higher mortality. I'll repeat that. A good idea. PVCs are bad things. If you suppress them, good things should happen. Well, guess what? Flecainide flecked people off the face of the world. I, not knowing at the time, gave a drug that I thought was doing good. It did more harm than good. And that's the beauty of randomized controlled trials. It gets rid of my bias that PVCs are bad, suppressing them are bad, and therefore you should live longer. I was wrong. And the whole medical community was wrong. And we changed our practice. Now I use these drugs to improve quality of life, to treat something called atrial fibrillation, but the side effect can be sudden death. So you have to sort of decide what to use about that. And we didn't know that back then. And this is actually a landmark trial many, many decades ago that happened early in my career. If it wasn't for this trial, we'd be doing the wrong thing. Next slide, please. Now let's talk about vitamin D and Alzheimer's disease. Is this so? We know that. Go ahead. Who's going to talk about this? Am I doing this, or are you doing this?
I'm happy to take this on. So, as Dr. Curnew was really saying, it's so important to rely on randomized controlled trials, which occur in really tightly controlled settings to help you recognize whether or not it's the particular medication is having a positive or negative effect on someone. So we would like to discuss some observational trials and randomized control trials on a number of different minerals and vitamins today, just to give you a sense of whether or not some of the things you might be taking are perhaps benefiting you or having an adverse reaction or having negative implications. So in this case, the first thing we want to discuss is the proposed association between vitamin D consumption and Alzheimer's disease. So this was an observational prospective population-based study, which was done by Littlejohns and colleagues in 2014. And it showed that vitamin D deficiency in elderly patients is associated with substantial increased risk of all-cause dementia and Alzheimer's. So in this study design, they took a group of participants and categorized them into vitamin deficient individuals or normal individuals who weren't vitamin deficient. And then they followed these patients in the future to see how many participants in each group developed all-cause dementia or Alzheimer's disease. By comparing the incidence in the two groups, the researchers found that those who are vitamin deficient were associated with a 53% increased risk of developing all-cause dementia and a 69% increase in developing Alzheimer's disease. Remember, this is an observational study. So although there is this temporal association between the two, vitamin D deficiency and dementia or Alzheimer's, we can't really be 100% sure that there is an actual causal relationship between the two. And that's why it's really important to do some more randomized control trials, which we're going to get into next.
So one of the things to realize is that having low levels of vitamin D is not a good thing. And people who don't go outside, we live in Canada, and certain times of the year we don't get enough sunlight. So I will say that you can get adequate vitamin D levels for many of us in North America during the summer months by spending 15 to 20 minutes being outside and getting vitamin D that way. So, but you can see that vitamin D, and people who never go outside, who can't go outside because they're too sick, will have lower vitamin D levels is one part of that. So that's not the whole story, but this is actually very provocative data that having low vitamin D levels are bad for you. Question, what to do about that? Next slide, please. What happens next there, Stuart?
Yeah, exactly. So this begs the question, does this mean that taking vitamin D supplements is going to protect me from developing Alzheimer's and dementia? So to answer this patient's question, more high-level evidence is needed to verify whether taking additional vitamin D supplements is going to really have any preventative effects. On the next slide, we discuss the VITAL trial. So this is a randomized control trial. Again, randomized control trials are the best gold standard, as we were discussing. So in this large-scale trial, what the researchers looked at was the effects of vitamin D and omega-3 on the prevention of cancers and cardiovascular disease. Researchers also looked at if vitamin D supplementation could delay cognitive decline. So the study sample consisted of a little over 3,000 healthy participants. These were individuals aged 60 to 91 years of age, with a mean average age of about 72 years. And these participants were randomly assigned to two groups. Okay, so the first one, they were assigned to take vitamin D3, while the other group was taking a placebo pill, which was going to have no impact on their health. And they wanted to look at whether the vitamin D tablets were going to have any preventative impacts in terms of preventing cognitive decline. So this study on average lasted about 2 to 3 years, and at the end of the study period, although they did find that supplementation led to an increase in vitamin D levels, 25 hydroxyide vitamin D levels, it did not actually have an effect on cognitive function nor delay cognitive decline. So that's really interesting if you want to just click on the next button here. So really the takeaway here was supplementation of older individuals with an adequate dosage of vitamin D3 did not actually decrease the risk of having cognitive decline, which is interesting because you think with everything we discussed, wanting to boost your vitamin D levels, it is going to actually prevent the cognitive decline. And that's why it's important to recognize whether it's better to get the vitamin D naturally or through supplementation, which based on this study shows that supplementation was not benefiting them. Doctor? Did you have anything you wanted to add there? Oh, sorry.
Yeah, so Didi, can you just do me a favor? Can you just check this? I'm thinking it's something called a VITAL trial that had 25,000 patients. I'm not sure if it's this one. This was actually looking at vitamin D to prevent cancer and heart disease, and that was negative. So if you can just take a look at that, just do a little search as we're going on right now. So the VITAL trial that I'm thinking about was for heart disease and cancer, and that was negative. So we know that and the vast majority of those patients probably had normal vitamin D levels and in the trial. There's been a couple other trials that in people who have normal vitamin D levels, adding to that does not affect outcome measurements. So once you get to a certain level of vitamin D, giving more does not appear to be protective. But we'll look a little bit more into that. Next slide, please.
Yeah, so on the next slide, we looked at another randomized control trial, which looked at the effects of vitamin D and calcium on cognitive functions in elderly women. They recruited over 4,000 women aged 65 years or older, treated them with calcium and vitamin D3 for a period of about 7.8 years. So this was assigned to two groups. The first group was in individuals receiving calcium carbonate with vitamin D3 supplementation each day, and the other group was the placebo group. So in comparing the incidence of dementia, cognitive impairment, and overall cognitive function between the groups, they found, if we click the next button here, no significant difference, thus indicating that vitamin D supplementation may not also have preventative effects in healthy aged women as well. So what is this really telling us? Well, overall, in relatively healthy populations, vitamin D3 supplementation, if we go on to the next slide, does not provide meaningful cognitive benefits. So although there is contradictory evidence on whether or not vitamin supplementation benefits cognitive function, most of them show that there is no effect. So the overall conclusion is as such. If you go on to the next slide, we will show you right there. Dr. Curnew, did you have anything you wanted to add in regards to this?
Yeah, so I think is that in people who have a normal vitamin D level at baseline, adding more vitamin D does not help your brain, doesn't help your heart, and doesn't help against cancer. We'll have to go back and now we have to go. It doesn't mean in people who have vitamin D deficiency, because most people who get into clinical trials tend to have normal levels. They're healthier by design. People who take vitamins and supplements are healthier people. They're trying to be healthier. So basically, my conclusion is that, and we'll show you what a normal vitamin D level looks like. If you have a normal vitamin D level, taking extra vitamin D does not appear to be protective, and that's disappointing because I thought maybe a higher dose would be helpful. So, so if you're vitamin D deficient, that's a different story. If you have normal vitamin D levels, adding more to that doesn't give you very much. It just helps the person selling the vitamins. Next slide, please.
Yeah, so now we're going to get to the point that Dr. Curnew was discussing regarding heart health and preventing cancer. So if it's not protective for cognitive function, are these vitamins going to do anything for my heart health or preventing cancer? So we wanted to answer that question with a study that was conducted. Again, this was the VITAL trial on the next slide. So the VITAL trial, as mentioned before, was a really, really large randomized control trial, which looked at vitamin D and omega-3 supplementation and preventing cancer and cardiovascular disease. So in this study, they recruited over 20,000 US healthy men and women who did not have cancer or cardiovascular disease at the time of recruiting these individuals. Recruitment was done based on age, so what they wanted was males aged 50 or older and women aged 55 or older. And in this study, participants went into two different groups. In the first group, they were either assigned to the vitamin D3 group or the placebo group. But then they did a second randomization, where participants then went into each group to be further randomized into the omega-3 group, which is the EPA-DHA group, and the placebo. And this, if we click once, you'll see that the reason that they did was to allow the researchers to examine the effects of, indeed, if we can click it one more time, vitamin D3 and placebo. So they wanted to show a comparison between these two, whether the vitamin D3 is going to prevent cancer and cardiovascular disease versus placebo, which would have no impact. If we click it one more time again, they also wanted to look at the comparison between omega-3s and the placebo group to see if taking omega-3 supplements was going to have protective effects. And finally, if we click one more time, they wanted to directly compare vitamin D3 and the omega-3 group. So if we go on to the next slide now, you'll see what the researchers were able to deduce based on their research. So what they essentially found was that altogether the trial showed that neither vitamin D nor omega-3 combination supplementation reduced the incidence of having cancer or cardiovascular disease compared to placebo. In total, across all arms of the study, about 16,000 participants were diagnosed with cancer. About 805 participants experienced major cardiovascular events, which included heart attack, stroke, or death from cardiovascular diseases. And as you can see from the numbers listed, there seemed to be a small difference in numbers between the intervention and the control group. However, and if we click the slide one time here, these differences were not statistically significant. So what this really means is that the observed differences could have just been due random chance alone and had nothing to do with the overall conclusions of the study. It was unrelated to the treatment. Dr. Curnew?
Yeah, so it's interesting. This is a vital trial I was talking about. You showed another trial called Vital, a different one in depressed levels. So you can see there's lots of information. There's usually there's thousands of information right now. So you showed a previous trial that showed in people that had low vitamin D levels that didn't help cognition. This is actually a trial that suggests in people with normal vitamin D levels, there's no benefit for cancer and heart disease. So this is the trial I was thinking about. Thank you for showing that right now. So that's disappointing. I thought, more would be better, but unfortunately, more is not better when it comes to vitamin D after a certain level. Thanks for sharing that.
Absolutely. So now we've discussed a little bit about vitamin D supplementation. We want to transition over to something that is now a very common topic of conversation, and that has to do with.
But before you go on to this, since this trial with the Vital trial, trials need to be replicated, and it was replicated 2 other times as well. So we have three randomized controlled trials that in people who have normal vitamin D levels, it's not going to help you, unfortunately. So more is not better at this stage. And disappointing, but that's reality.
Mm-hmm.
Next slide, please.
Yeah, Dr. Curnew, did you want to take the lead in regards to fish oils, or did you want me to discuss this one?
Sure, let's go to fish oils. Fish oils have been interesting. It's one of the most common supplements people take. Let's take the next slide, please. What do we know so far? That there's different forms of fish oil. So we get omega-3s are basically, we can't make them. So therefore we have to eat them either through supplements. We have the vegetable form called alpha-linolic acid, or DHA and EPA, the 2 major fish oils that we can get from fish, or we can get from fish oil capsules. And basically we divide up into EPA that gets converted to IPA. So pure EPA is one form of a fish oil, and that seems to have most beneficial effects to the heart. DHA seems to have beneficial effects to the brain and to the eyes. But the problem is when you go to the store and you buy a fish oil supplement, it's not pharmaceutical grade. It has saturated fats. It often may be rancid. It has contaminants. You're not getting a real form of DHA and EPA. So we've learned that the stuff you buy over the counter, unfortunately, is not what's on the label. What you get inside are 2 different things. And so therefore, you need to think of the pharmaceutical grade DHA and EPA. So all the stuff you buy over the counter is probably impure and not good for you. Next slide, please. And this just talks about this over here about the contaminants and the risk. And you can see that Health Canada has given pure IPE, and that's something called Vasipa, beneficial effects as being highly purified and has potential for benefit. And the commercial supplements that you get over the counter, unfortunately, don't really contain what's on the label, and they have impurities. You can get pharmaceutical grade DHA and EPA. Next slide, please. And so you have to know what you're getting, what you're doing. In one of the trials called Reduce It was a landmark trial of about 10,000 patients that had heart disease, high triglycerides, that were randomized to pure IPE or EPA at 4,000 or 4 grams a day of pure EPA versus placebo to EPA. Next slide, please. The period of follow-up was about 5 years, and it showed basically they took patients that were older people, the age of 45, had diabetes, risk factors, their cholesterol was not badly controlled, had high triglycerides, and we have a whole separate webinar on that. Next slide, please. So a really structured trial, and it showed, look at this, close to a 25% reduction in chance of having a heart attack or stroke. Bypass surgery, angioplasty were all reduced by 25%. Landmark trial. Next slide, please. So looks like EPA has multiple benefits of decreasing inflammation, stabilizing membranes, affects oxidative stress, It lowers remnant triglyceride particles, have multiple potential benefits of IPE or EPA, as well known. And this is on top of statin therapy, a medication that lowers cardiovascular events. Remember that statin therapy, high dose statin and ezetimibe in high dose can lower the risk of having a heart attack or stroke by 60%. You can add pure EPA or IPE, and that lowers risk by about additional 25%. Next slide, please. And so life was good. Well, why not using commercial grade EPA and DHA, a trial called Strength. Strength was a trial of 15,000 patients or thereabouts that were given 4,000 milligrams of a mixture of EPA and IPA. And it showed overall, next slide, please, no benefit. And that's surprising. I would have thought the combination of EPA and IPE would, DHA and the combination of a fish oil of would be a benefit, but pure EPA, or which is converted to IPA, shows value, and the higher your level, the more value that you get. And some of that you can get some from fish, for instance, and that what you saw in the reduced trial. But the combination of both negate the benefit. So so basically, what I'm saying is that any over-the-counter fish oil supplement you get is not purified. It doesn't work. The only thing that works right now is a medication called Visipa, which costs just under $10 a day, and it's by prescription only. And we're still learning a lot. So if you want to take fish oils, the only one that shows a value is pure EPA at this point in time. And that's where we are right now. And the combination of both does not show value at this stage. And we still have a lot more to go because they use different placebos or different trials, and we're evolving right now. So disappointing that the fish oil capsules you get over the counter don't work. And we do know that fish oil capsules can increase atrial fibrillation on a regular heartbeat. All of them can do as well. So if you want to consider taking fish oils, the only one that's readily available right now is Visipa, which is a purified form of EPA and by prescription only. Next slide, please. Who would have thought? Only that by good clinical trials. So next slide, please. So there's where we are at this stage of the game when it comes to fish oils. Maybe fish oils have some value to the brain and to the retina, but right now for heart disease health, the only thing that works is pure EPA by prescription drug only called Visipa right now. And we're still going to learn more as time goes on. Next slide, please. And here's the medication. You have to take 4 of those capsules a day, and it is expensive. You can get a discount, and they're covered by some drug plans. They're not paid for by the government. I think this is a very good solution, but it's just too costly. And I hope the price comes down so we can all make this affordable, because right now this is not an affordable solution for the vast majority of Canadians. Next slide, please. So key messages is get your LDL cholesterol, the bad cholesterol, down to less than 1 with the good diet, lifestyle changes, good dose of the statin and ezetimibe, over-the-counter fish oils, or the combination of DHA and EPA, unfortunately, is not cardiovascular protective. The reduced trial follows another randomized trial called GILIS. GILIS was done in Japan many years ago that showed that taking pure EPA on top of a high consumption of fish was cardiovascular protective. And again, lifestyle changes are the backbone of therapy. And if you're going to rely on fish oil capsules to make you live longer, the ones you get over the counter don't work. The only one that works is pure EPA, pharmaceutical grade by prescription drug only. Next slide, please.
So at this time now, Dr. Curnew, I think it's important to discuss, yes, as we've talked about, there is some disappointing news surrounding fish oils over the counter, not having the benefits perhaps we wanted, but it's also important to recognize that perhaps taking vitamins or supplements may actually have a negative impact on our health, might actually be detrimental to our overall health. So we wanted to take a look at some research that was clarifying whether taking too much vitamins is going to have negative impacts or if it's going to have no impact at all. So on the next slide here, the first thing we wanted to talk about is beta-carotene. Beta-carotene is essentially something that we often take. It converts to vitamin A, and vitamin A is needed for a number of different things, mostly vision health, eye health. supporting our immune function as well as healthy skin and promoting good mucous membranes in our bodies. So this was a randomized control trial which recruited individuals who were between the ages of 50 to 69 years of age. They were specifically looking at male smokers. They really wanted to see if taking beta-carotene was going to have positive impacts on supporting their lung health. So they recruited over 30,000 individuals, randomized them to the beta-carotene group or the vitamin E group, or a placebo group, basically a sugar pill or something that was going to have no benefits to them. And what they found, if we go click it one more time here, is that the beta-carotene supplementation group actually had a significantly higher risk, between 22% to 31%, of developing lung cancer in this population, which was made of 30,000 male smokers. Now, this was a study that was done in Finland, but there were also some other studies which confirmed these findings. As Dr. Curnew said, it's important to redo these trials just to make sure that the results are accurate. So there was one that was called the ATBC study, which reported that there was an 18% excess of accumulative lung cancer incidence in individuals who were randomized to this beta-carotene group, and an 8% increase in having overall mortality in this group. There was also another group called the CARROT study, which showed that there was a 28% increase in lung cancer in the group that was taking the vitamin E or the beta-carotene, and a 17% increase in overall death in this group compared to the placebo. So really, this does show that it's important to have a background knowledge on how these vitamins and supplements are supporting or perhaps having a negative impact on your overall health. And that's why it's so important to do these trials, to make sure that what you are taking is supporting your health. And, you know, we always talk about maybe if it's a vitamin that's not benefiting you, at least it's having no harms. But in this case, you can see that taking beta-carotene was having some very real harms to individuals who had a history of smoking.
So this is very interesting. Again, beta-carotenoids are 200 to 300 different molecules found in carrots, for instance. We believe they are protective for cancer, but taking beta-carotene, which is one thing was an active part of that moiety, actually increased the risk of lung cancer. And the vitamin E component was relatively neutral. So taking beta-carotene increased the risk of lung cancer if you're a smoker in more than one trial, and vitamin E showed no harm, but no benefit.
So if we go on to the next slide, we want to now breeze through a number of different vitamins and minerals just to see what the research is saying regarding whether or not this is having a positive or negative impact on our health. So first, starting with vitamin E supplements. So what researchers were interested in looking at was whether taking vitamin E was going to actually have a benefit at reducing your risk of all-cause death. And what they found by pooling over 57 studies, which is up to 250,000 patients who were randomized, they found that vitamin E supplementation was not really associated with a reduction or an increase of all-cause death. As you can see, a lot of the results were teetering around the midline, and based on this little black diamond you see at the bottom right here, which is right on line of 1, it shows that taking these supplementations was having no impact on prolonging your life.
This is actually quite interesting. Vitamin E as an antioxidant was the wonder vitamin 20 years ago. Initially, people who take vitamin E had less heart disease. And then there was some, and this trial shows us the center line, which is unity. Anything to the left is positive, anything to the right is negative. And if you look at the pooling of all these data in 250,000 patients that were randomized, vitamin E does absolutely nothing. Except make your pocketbook deplete. So that's actually important to realize that. And you have to do multiple trials because we believe strongly that vitamin E was an antioxidant that would do you some good. Unfortunately, it didn't hurt you, but it didn't help you. Next slide, please.
So on the next few slides, we'll go through them quickly, but you see it's a very similar story for a lot of the vitamins and minerals we're going to be discussing. First, calcium. You can see again, this little black diamond is teetering around the midline, meaning it isn't favoring any side. Really, taking calcium supplements was having a neutral impact on an individual's health. It wasn't prolonging mortality, and this was an accumulation of a number of different studies. And if we just quickly go through the next few, you'll see that's a very similar story on the next slide, which is for vitamin A, again, teetering around the midline, a vitamin A supplementation having a neutral impact on prolonging life. Similar with folic acid on the next slide. You can see right here, no impact. And then on the next slide, vitamin C. So vitamin C supplementation, again, they found that it was not having any positive or negative impact in this regard in prolonging an individual's life, comparing individuals who are taking vitamin C supplementations versus those who are not taking vitamin C supplementations. So vitamin C specifically, if I can focus on it for just another minute here. If we go into the next slide, vitamin C supplements have recently been talked about as a way of, managing symptoms and side effects of individuals who've been diagnosed with COVID-19, and so it's been a topic of discussion. You can see right here that this particular study pooled a number of different literature and looked at whether vitamin C supplementation was having any impact on death, length of ICU visits, duration of your hospital stay, or having to undergo any invasive mechanical ventricular, having to use any invasive mechanical ventilation devices. And so again, you can see right here that in all 4 of these studies, the results were neutral. So vitamin C supplementation was neutral in managing COVID-19 symptoms or outcomes. So when looking at major health outcomes of COVID-19 patients, vitamin C supplementation really didn't show any improved outcomes. And this is what the current research has been telling us in regards to vitamin C supplementations. And on the next slide here, we just want to talk about substantial rates of adverse events in the COVID vaccine placebo. So this was a meta-analysis of about 45,000 individuals. And what they found was that 35.2% of placebo recipients experienced systemic adverse events after the first dose. After the second dose, they found that 31% of individuals who received a placebo vaccine also received or had adverse events. So what they saw was that the ratio between individuals who received a placebo vaccine, so a vaccine which was really having nothing in it, and an actual COVID-19 vaccine, basically showed that there's very similar reactions in regards to having adverse events, which may suggest that some of the adverse reactions or events that you may be experiencing following a COVID-19 vaccination may in fact be the placebo or the placebo effect based on this meta-analysis which is recently conducted. Dr. Curnew?
So this is actually very interesting. This is actually randomized data. You either got real vaccine or fake vaccine. And it said that 3/4 of the side effects were just as common or related to the called the nocebo effect. If you think a vaccine is bad for you, you will have a side effect most of the time. And it showed for the second dose, it was reduced that 50% of the side effects were a belief system or just as common in the real vaccine versus fake vaccine. Now, you get a vaccine, depending on the vaccine, you will get local irritation, inflammation, swelling. And, if you go back to that, we don't have to go back to that, but if you're going to rely on vitamin C to protect you from COVID, you can see that the pooling of good scientific information shows no harm, but no benefit. We do know with the initial round of COVID that the vaccines were about 80% to 90% effective at decreasing serious infections from COVID in relatively healthier people. And we found out that in older individuals, it also worked there too as well. What we didn't know is how long immunity would last for. And that's we're learning about that. That's why these boosters are coming. The other thing too that's happened is the vaccine has mutated. Our vaccines will have to adapt and change like influenza shots at this point in time. And what we also learned is that getting COVID makes you more likely to have a heart attack, stroke, blood clots, bad outcome the next year or so after getting COVID. So getting COVID is not a good idea. I rather get COVID being vaccinated so the severe disease are lessened. So this reminds us says that if you believe that the vaccine is bad for you, then 76% of the time after the first shot, it's a belief system. And after the second shot, it's a 50-50 split. So remember is that in God we trust, everything else needs science. And this is what science tells us at this point in time. It takes away the bias out of things. Next slide, please. Very, very important information to understand this process right now. Do you want to take care of this one there, Stuart?
Yeah, absolutely. So just looking into some other research as well, it's important to recognize that, okay, some vitamins and minerals may have a neutral impact on increasing or reducing my chance of death, but perhaps they may also have some adverse risks to you. So this was the first study which basically showed that taking extra calcium or vitamin D may actually increase your risk of impacting your renal system and leading to the development of kidney stones. There was another study conducted in 2010 which showed that high doses of vitamin E, or overprescribing or taking too much supplementation for vitamin E, actually could have a positive impact in increasing your chance of having an adverse event, specifically a stroke, which is a brain bleed. And there was another study in 2014 looked at over supplementation of vitamin K might actually interfere with anti-clotting agents. Vitamin K is important in hemostasis. It's really important in promoting clotting factors, which are going to help create blood clots, which your body needs, oftentimes to heal wounds, for example. It has many important functions, but overtaking too much vitamin K may actually interfere with the anti-clotting agents that are in your bodies. So if you can't unclot the clots that you're making, this can lead to blockages in your arteries, which could eventually lead to a cardiovascular event, heart attack, or stroke. And so that's why it's important to recognize that taking too much vitamin K can actually have a bad impact on my health. And then finally, there was a study conducted not too long ago in 2020, which said that taking high amounts of vitamin B6 for a year or longer has been associated with some nerve damage, which can impair bodily functions. Symptoms, fortunately, often stopped in this study after the supplementation was reduced substantially. So really just the main takeaway here, before I pass to Dr. Curnew, is the recognizing that, yes, vitamins, we often think that maybe it's not helping, but it's not harming. But it's really important to recognize that there is a lot of research out there that shows that taking too much supplementations for someone who has a good already amount of vitamins or minerals in their body can actually impair your body's natural functions and can lead to adverse events. Dr. Curnew?
Yeah, I think, is that it's absolutely true. If you suffer from kidney stones, taking extra vitamin, many stones are calcium related. If you have a calcium forming stone, having extra calcium or vitamin D will increase risk of having kidney stones. Remember, is that you have to work with your physician. Now, if you have thin bones, osteoporosis, you might need some extra calcium and vitamin D, and that's specifically indicated. So if your vitamin D level is normal, that's what you want to get to that, and you can actually measure that. And calcium, as Aditi points out, is better absorbed through food than through supplements. So I try to get most of my nutrition through foods, and you can see that single supplementation or combination supplementation can have adverse effects. I would never predicted that pure EPA was good for you. The combination EPA and DHA negates some of that benefit from the heart, but that's what the data shows. You learn and you adapt. I never would have thought that flecainide was a bad drug for you by suppressing PVCs. It was a bad drug, and it's still a useful drug in the right circumstances, but just so again, look at how science evolves and how it changes at this stage. Thanks for sharing that. Next slide.
Yeah, so at this time, I think it's important to recognize, okay, so what is the demographic which may actually benefit from taking supplements, both vitamins and minerals? So Dr. Curnew is going to be discussing individuals who may be anemic or who have low iron. But before we do that, I want to briefly discuss what research is suggesting regarding the use of vitamins in individuals who are pregnant, women who are pregnant. So the next slide here, American Association of Obstetricians and Gynecologists recently has recommended taking prenatal vitamins to help support proper fetal development and support the extra demands that a pregnant woman's body is going through to not only support themselves, but of course the fetus as well. So this includes folic acid, calcium, iron, vitamin D, iodine, and vitamin C. So folic acid, based on research, may prevent the neural tubes in the heart from having defects. This is in the fetus, which is developing. And so it's important to ensure that you have enough folic acid in your body to not only support yourselves, but also the fetus as well. Iron is really important. Iron is an important part of hemoglobin, and hemoglobin is an important part of carrying oxygen on your red blood cells. And so without enough oxygen in the red blood cells, you're not being able to support the fetal development. And so it's really important for an individual's pregnant woman who has a history of anemia, fatigue, or is experiencing anemia as a result of her pregnancy to perhaps take iron supplementations with the recommendation from her family doctor or her healthcare provider to ensure that she has enough iron in her body. Calcium, of course, is important for growing strong bones, teeth, and muscles. Vitamin D is really important and supports the absorption of calcium, which then supports the development of strong bones. Iodine is really important for promoting brain development in fetuses. And finally, vitamin C can promote healthy gum development, teeth development, and bone development as well. And so while there are some instances where an individual who's healthy may be taking too much supplementation. Pregnant women maybe fall into a separate category, but it's important to go on the recommendations of your healthcare team to ensure that you're taking the appropriate supplementations to support yourself if you are a pregnant woman. Next slide, please. So at this moment, I wanted to pass it along perhaps over to Dr. Curnew, who's basically going to be discussing some of the recommendations in regards to individuals with low iron. First, what is anemia? And then on the next few slides, just talking about what an acceptable hemoglobin and iron level is. Dr. Curnew, is that okay?
So when your red cell count is low, we call that anemia, your hemoglobin. There's many types. One is called iron deficiency anemia. Traditionally, we measure something called ferritin, which is a reflection of your iron stores, but it also can be elevated from other causes. And we know that many people that are plant-based eaters may be iron deficiency. Women who have heavy periods could be iron deficient. Interesting, when you have you can get too much iron as well. The body doesn't really have a great mechanism for getting rid of iron, except for women who are menstruating, of course, who have children because the baby needs iron. I will say that you can get good iron from things like spinach, sweet potatoes, peas, broccoli, string beans, and these are rich foods that are rich in iron that are important, that have other nutritional values as well. Well, I just see that Rachel's joined us too as well. So Rachel Liu is actually at the University of Toronto, and please feel free to join at any point in time that you'd like to. So one form of, so not all anemia is iron deficiency, but something to think about. Next slide, please. Interesting is that, these are from the some American data, what should be a normal hemoglobin. First of all, that hemoglobin is a little bit different in males and females, and we have different definitions of deficiency. We have different definitions of what hemoglobin level should be, and different supplementations. And and as we get older, we start to lose a little bit of iron. We leak it through our bowels. Our nutrition may not be as good as in younger life. So next slide, please. So we have different things to think about. And this is actually, physicians are confused because experts are confused as well. These are different definitions. So the Medical Council of Canada has a definition of what iron deficiency is. We call it a normal iron level between 10 and 30. Up to date, which is a common resource by many physicians, use 45 to 80. And our local lab here in our forums has a different number too as well. We use ferritin often as stores of iron. You can see on the far right, the Medical Council says 10 to 300, a very wide range, and that's kind of weird to be that different. Up to date says 4,200. Local lab says 24 to 440. The bottom line is that there's different definitions of iron deficiency by different organizations. Next slide, please. So it is confusing to experts. It should be confusing to you too as well. This is a little bit more complicated. You can see the heart at the top here needs blood to be pumped, and blood is produced by your bone marrow. Your kidneys provide something called erythropoietin that makes your body help make iron. Certain medications can affect how your body absorbs iron. We know that iron is best absorbed on an empty stomach, adding with vitamin C to that mixture. And we know that once you have inflammation going down from sick or chronic kidney disease or from infection, your body doesn't utilize iron properly, and it forms other substances that block the formation of iron well. One definition by the European guidelines in congestive heart failure, because congestive heart failure is a disease as we get older in life, full of inflammation, carries a definition of iron, a ferritin level less than 100, or a number between 100 to 290 with something called transferritin saturation less than 20%. That's one definition, a standard definition, but there are different definitions. I don't want you to get too excited about that. That's the job of your physicians. But there are different definitions and different disease processes, different times of your life, and males and females are different. So it is confusing. Next slide, please. So we're learning all the time. And I think one of the things that I'm still, after being in practice for 30 years, still a little bit confused, but I have a better understanding about iron metabolism. We're still learning about this. there's other values too, vitamin D and B12. Look at the definitions of vitamin D. You can see that in your left that the Medical Council has a normal vitamin D level between 75 to 250. Up to date says over 50. A local lab says something different. B12, somewhat different as well. So we're still learning and we're still understanding this. That's why you have to rely on the expertise of physicians, your local family doctor, and sometimes specialists can help in this distinction as well. So the world is a little bit fuzzy sometimes about certain definitions. So I put these numbers here to realize that there's not absolute numbers, just different. I see James over here who helped put this together and taught me a lot in the last week or so, gave me a headache as well. And we're still learning about this. And you talk to your local family doctor, they have a headache too because the definitions keep changing, and that's okay. Things change, science change, we'll keep updating about this over time. So I just want to give you a flavor what physicians are thinking about as well. Next slide, please. Any thoughts from anybody about that as well? These are some of the definitions of vitamin deficiency, what can happen along the way, but these are things that we learn. I think Aditi is going to take over about this part, if I got this right.
Yeah, I think Aditi is going to take over on the next slide. Basically, the takeaway from this one, before we get into her section, is yes, there are several conditions that can result from vitamin deficiencies, and these would likely be diagnosed by your family doctor or your specialist. In these cases, they may prescribe supplements to treat your deficiencies. However, as we've discussed today, it's very important to ensure that you're taking the correct dosages, because while maybe taking too much vitamins or minerals might have a neutral impact on your overall health, there are some instances in which it can actually have an adverse impact on your health as well. And so making sure that you have appropriate prescribed dosages to minimize side effects and potential overdoses is really crucial, and your family doctor or your specialist can really be helpful in helping you differentiate what is the appropriate amount and what is perhaps too much.
So I think you pointed out where reminds me about the porridge is too hot or too cold or just right. And getting it just right is a moving target, and that there's lots of variables. So you have to rely on the expertise of the people on your team to help about that a little bit. So and we keep learning. So this is what happens when it's too low. We also know when it's too high, which you can show. Getting it right is something quite good about this. And when you eat real food, your body picks and chooses, and it knows how to get to a better level versus just jamming a supplement down your system and hoping for the best. Next slide, please.
Yeah, so we're just going to briefly go over kind of a conclusion, but also talking about how we can get some of these micronutrients, these vitamins and minerals that you commonly find in supplements from your diet. So, one second, sorry, technical error there. Okay, so supplements versus diet. So supplements, it's important to remember that they're not a substitute for a balanced diet. So the best thing for you to do is just to eat a variety of foods in order to ensure that you're getting the most micronutrients, and kind of use supplementation in the event that you're actually deficient in something and do need kind of that extra resource. So most micronutrients like vitamins and minerals can be obtained from diet. The one exception that we've kind of pointed out a few times tonight is B12. So B12 is primarily from animal sources. If you are on a primarily plant-based diet, it's very likely you need to supplement B12 because you're probably not going to get it from your diet. So just looking at this graphic on the right here, it's talking about micronutrient sources. So we can see things like B vitamins, calcium, vitamin C, vitamin D, magnesium, selenium, and iron. You can get them from a variety of different nutritional components. So for example, vegetables cover most of these things except for vitamin D. Fruits are also a really great source of B vitamins, calcium, vitamin C, magnesium, selenium, and iron. Whole grains will provide a variety of different nutrients. So in addition to your vitamins, calcium, magnesium, and selenium, oftentimes there are whole grain products that are fortified, and these can be a really great source of vitamin D as well. Then there's dairy, which is a good source of some vitamins and minerals, but also vitamin D. Dairy is often fortified with vitamin D, which can make it a great source if you're not, getting enough vitamin D. And finally, meat, eggs, nuts, and beans are also a really great source of B vitamins, calcium, vitamin C, vitamin D, magnesium, selenium, and iron. So there is a variety of different foods that you can eat in order to get your daily intake of vitamins and minerals, and it doesn't all have to come from one particular food group. So eating a combination of great fruits, vegetables, grains, dairy, nuts, beans, meat, or eggs, depending on what your diet calls for, can give you an adequate dose of these vitamins on a daily basis.
So if you backtrack, Aditi, so you can see that there's lots of controversy in certain areas. For instance, is that for calcium, we want about, you mentioned about 1,000 milligrams of elemental calcium a day. And if you want dairy products, usually each serving of dairy is about 250 milligrams of calcium. Well, I just had a lot of homemade soup that had broccoli and kale. If you look at that, as broccoli and kale are very rich sources or richer sources of calcium. I put soybeans to most things that I do at this point in time. What happened is I live on a farm, so we grow soybeans. So I have my own soybean that I can add to that. And it's a great source of protein and calcium, as well as other micronutrients as well. So this is something that you're going to have to realize, is that Mother Nature has put together a cocktail of food. And we as human beings, when we try to divide and conquer, have done more harm than good. And you can see that we don't always agree on what the level should necessarily be. We know what you're truly deficient, but that's pretty rare at this point in time. So if you're a vegetarian, for instance, calcium is often a problem. But if you're a vegetarian, you also, and there's actually data that shows that we live in COVID time. If you're a meat eater, you're 400 more times likely to get severe infections from COVID. And if you're a vegetable eater or a fish eater, you're less likely to get sick from COVID as well. These are observational data, but there's persuasive saying that Mother Nature's cocktail of healthy foods is better than the processed foods and the supplements that we're trying to add to our food supply. So this is the orchestra of health. It's what Mother Nature intended us to do, and we need to get back to real whole food most of the time to be healthy.
Next slide. That was really well said. That's basically the point we're trying to drive home, that supplements, in the event that you're truly deficient, yes, they might be indicated. However, for most people, just by eating a wonderfully balanced diet, you're able to get all of the nutrients that you need from natural sources, and you're able to kind of have them work in a more natural way. So we're going to go a little bit more in detail into some of these vitamins and minerals, just to discuss potential sources and some information. So vitamin B12, like I mentioned, comes primarily from animal sources. If you are completely plant-based, it is very likely that you will need a vitamin B12 supplement because you have no dietary sources of it. There are a few plant-based products that are fortified with vitamin B12. So for instance, nutritional yeast, breakfast cereals, soy products, some dairy products. However, sometimes the amount that they're fortified with, you have to eat quite a large amount in order to get your recommended intake of vitamin B12. So several recent systematic reviews show that among vegetarians, there are vitamin B12 deficiencies that last throughout life. And you can get your vitamin B12 levels checked by your doctor. It's part of an investigation for anemias. And vitamin B12 supplements are commonly taken by people who are predominantly plant-based eaters due to the lack of sources within their diet. It's important to note that for vitamin B12, we discussed earlier, it's involved in nerve function. So you don't want to continue to be deficient in your B12 over time. And B12 actually can last in your body for several months. So even if you're not taking it on a daily basis, you're kind of borderline in terms of a B12 deficiency, taking it maybe a couple of times a week is something that can be very beneficial. So I myself am a plant-based eater, so I take my little vitamin B12 every day because I have no dietary sources of it. So for calcium, this is really crucial for bone health and for a variety of other functions. But we often observe that a deficiency in calcium can often lead to an increased risk of osteoporosis. And calcium is extremely important for people who are peri or postmenopausal. Due to the hormonal changes, there is an increased need for calcium. So most adults aged 19 to 50 years of age tend to require 1,000 milligrams of calcium per day. This is the recommendation per the NIH, or the National Institute of Health. And this is the amount that's actually present in 3 8-ounce glasses of milk. That just kind of shows you how dairy has a real concentration of calcium. So Dairy tends to be the best source of calcium if you're thinking about the amount you need to consume to get the required calcium, but there are several non-dairy sources as well if you're someone who can't consume dairy or would like to not consume dairy. However, you do usually need to eat a larger volume of these foods to get the same amount that you would get from dairy. So in terms of some plant-based sources, you have things like chia seeds. So 2 tablespoons will have 179 milligrams of calcium. Soy milk, so 1 cup of fortified soy milk will be equivalent to 1 cup of cow's milk. So make sure you look for a fortified version. Sesame seeds, 1 tablespoon has 88 milligrams of calcium. The drawback with sesame seeds or with any seed or nut is the fact that they're also high in fat. So you need to be cognizant of the amount you're eating. Tofu, the calcium content will vary depending on whether, depending on like the type or the brand of tofu. So typically it ranges from 275 to 861 milligrams per half cup. So you can figure out what your brand of tofu has as the calcium content. Just look at the nutritional label and it should give you the information. And finally, white beans. So 1 cup has 161 milligrams of calcium. So we can see that there are some calcium-dense plant sources. However, compared to dairy, you would generally need to consume less dairy to achieve your overall calcium goal. That doesn't mean that you can't achieve it with plant-based products. You just have to be mindful and kind of eat larger portions of them. So next up is vitamin D. So we just talked about calcium. Your body doesn't adequately use calcium if you don't have adequate vitamin D. So there are various sources. The most common source is the sun, but we in Canada often don't get enough sunlight given that we spend a large amount of our months in winter and in darker days. So as a result, there are some dietary sources you can get it from as well. So egg yolks are a source. However, if you're concerned about cholesterol, this might not be something you want to consume. You can also get it from fortified dairy products, fortified breakfast cereals, and sunshine, as we already mentioned. So there is a chance that you may need a vitamin D supplement, especially if you're not going outside a lot, if you're not exposed to sunshine a lot, and you're not consuming foods that might be fortified with vitamin D. So you can speak to your physician about getting a test. It is an out-of-pocket cost. However, if you kind of do it on a one-time basis, you can understand where your vitamin D levels are at and make an informed choice about supplementation. If you recall from the beginning of this presentation, we talked about how vitamin D is a fat-soluble vitamin. So it has the ability to kind of accumulate and get stored in your body. So you don't necessarily want to be supplementing this or exceeding the supplement recommendations if it's not indicated for you. So that's something that you can speak with your physician about.
So one thing I would do is that if you're going to get a vitamin D level, the best time to get it is in the spring. Your lowest vitamin D level will probably be during the winter months because you don't absorb the same degree of calcium. You don't have as much sunlight. So the best time to get your vitamin D level is probably April when the sun starts to get up. Your highest level will be during the end of the summer months. And if you do get a value, you have to wait a number of months before you repeat that value. So we know that you don't need to be, once you're in the normal range, going higher, you don't get extra value. If you're too low, then there's potential adverse effects right now. So getting from low to normal makes sense. Going above that is of no value at this point in time. Go ahead. Thank you.
Yeah, so next up is omega-3s. So we've already talked a little bit about fish oil supplementation and kind of the controversy surrounding that. However, omega-3s are an essential fatty acid and they are associated with reducing triglycerides and reducing the risk of cardiovascular events. So there are the 3 types, ALA, DHA, and EPA. And there are a variety of dietary sources. The best source tends to be fatty fish. However, you can get some vegan sources of omega-3 as well if you're leaning a more plant-based direction. So some sources include things like seaweed, walnuts, salmon, mackerel, chia, flax, hemp, edamame, and kidney beans. These are all sources of omega-3 fatty acids that you can consume. Just a note about some of the plant-based sources, the percentage of, they tend to be more abundant in ALA. The percentage that gets converted downstream to DHA and EPA is fairly small. So just something to keep in mind when you're choosing your sources of omega-3 fatty acids.
And if you're going to use things like flax seeds and chia seeds, you need to grind them so you can actually absorb them. So I think these are good, healthy foods. we still have a lot to learn about omega-3s, and they're certainly good food. So it looks like the pure EPA is good for the heart, and you can discuss with your physician if you need to. Relying on over-the-counter fish oil supplementations, they don't work. They increase risk of atrial fibrillation. So this is a complicated situation. So eating these foods makes a lot of sense to me. Supplementation is in select people, and we can talk about that. And we're still in, we learned a lot. We have a lot more to learn right now.
So next up is potassium. So this is something we've kind of discussed in previous webinars in terms of blood pressure control. You want to lower the sodium and increase the potassium. So there are a variety of dietary foods that will give you a great source of potassium. So things like dried fruits, raisins and apricots, beans and lentils, potatoes, winter squash, spinach, broccoli, avocado, bananas, cantaloupes, oranges, orange juice, tomatoes, dairy or plant milk, yogurt, cashews, almond, chicken, salmon, the list goes on and on. And in terms of minerals, you tend to get like a great density of them in leafy greens and root vegetables because they are able to absorb that from the soil. So making sure you have an adequate amount of potassium consumption is not only just beneficial in terms of your regular body functioning, but it can have a great effect in terms of blood pressure management and regulation.
Just so people know, if you backtrack, is a baked potato has more potassium than a banana. And I eat the skin of the potatoes with a lot of the nutrients in it. And these nutrients have lots of micronutrients. Some we don't even identify at this point in time. Remember, we were talking about beta-carotene. Beta-carotene, unfortunately, kills, where beta-carotenoids and carrots and all the orange leafy things are protected to the heart. So these are, this is nature's vitamins. This is nature's supplements. This is the stuff we know that have value. And a recent randomized controlled trial done in China, where they actually replaced salt with a potassium analog, actually lowered blood pressure, decreases cardiovascular event. And instead of taking a potassium supplement, I would rather just take my potassium in the foods over here and get a lot more micronutrients that we're still learning about. Next slide, please.
Yes, so next up, we're going to briefly discuss magnesium. So as we learned in the beginning, magnesium has a lot of important functions in our body. However, there's a real caution that needs to be exercised when using magnesium supplements. They should only be taken if recommended by a physician, and sometimes they are recommended as part of treatment for headaches and insomnia. But if that's indicated for you, your physician will advise you of that. The main concern with magnesium is that it is a laxative. So taking excessive amounts of magnesium per supplementation not only means that you're risking going over that upper limit of 350 milligrams per day from a supplement form, but you're also going to basically wreak havoc on your digestive system. So it's important to try to get your magnesium from dietary sources. There are plenty of those. So the best sources are things like legumes, leafy greens, but also poultry, nuts, and seeds. So eating these foods in moderation throughout the week can give you the magnesium intake that you require. And if you recall from the initial slide where we talked about the recommended daily allowances, for magnesium, the amount you can consume from food is actually higher than that upper tolerable limit for supplements, and that's because supplements are so concentrated. So try to get it from natural sources when you can, unless you've been advised by your physician that you need to take it as part of a treatment protocol.
Again, in this cocktail of Mother Nature, you can see that your body can pick and choose what it needs to do, and it does a good job of this. If we try to force feed things, things don't work quite as well. And again, if you have kidney problems, then you might not have proper ways of handling magnesium and potassium. So that's why we can measure potassium level, talk with your physicians whether or not this is right for you. I'm quite impressed that if you get your calcium, your magnesium, your potassium from foods, your body has the ability to regulate that much better than getting through supplementation. So it's a much better way of doing things. Next slide, please.
Yeah, so the question really becomes, should I be taking supplements? So while various nutrients ranging from probiotics, omega-3s, zinc, vitamin D, vitamin E are all associated with great health benefits and immune function, the results we find from studies are often very divergent, and that's what we've kind of learned today, talking about the various studies and research that has been conducted on the efficacy of vitamin supplementation. An important thing to note is supplements are a largely unregulated market. So they don't have the kind of same rules in place as you would with like a prescription medication that your physician has advised you to take. So as a result, it can be a bit of a money grab, because oftentimes some of the research that's done on these some of the research that tends to be done on these supplements tends to be done by companies that are manufacturing the supplements. There's a lack of kind of confidence in that because it's not necessarily third-party tested. So if you think you need a supplement, the best thing to do is to speak with one of your healthcare providers and kind of go through why you think you might need a supplement and get their opinion on it, because a lot of times it can be unnecessary. Vitamin D, calcium, B12, and iron may be the exception to the rule, as for some individuals they are required, especially the B12 and the iron. However, basically most supplements are unnecessary, and eating a healthy, well-balanced diet usually gives you all the micronutrients you need. So to answer, should you be taking supplements? Probably not required, aside from maybe B12 or iron. But if you think there's a real concern or there's something that's extremely deficient in your diet, best thing to do is just speak with a physician, because a lot of times we can actually do a simple blood test in order to inquire what your levels are.
So what I would do to people, if you backtrack one slide, is I would get my vitamin B12 level once a year if I'm just a plant-based eater. If I have bone problems, then adequate calcium and vitamin D levels are important. And get me your vitamin D level again in the springtime. Right now is iron levels. We use ferritin, transferrin, saturation, serum iron levels, a cocktail of all the above, and it can be somewhat more difficult to interpret. You need to interpret in the context of being well. If you're sick, if you have a cold or a flu, we shouldn't measure these levels during that acute illness. You need to be well for a period of a couple of months before we measure these parameters to get really the right levels. And and I love that Mother Nature's cocktail. And we as human beings have not been able to replicate Mother Nature when it comes to supplements in large, and maybe done more harm than good.
Yes, I'm going to pass it off to either Stuart or Dr. Curnew to take the last slide.
So to me is that beautiful music is beautiful music, and you have one person performing, you hear beauty. You get the real beauty, the symphony of life by the cocktail. And I view is the violinist is basically is either vitamin C, beta-carotene, whatever you want to do, and the symphony of life and the symphony of health is that cocktail. Sometimes we don't know the entire cocktail how it should be. Beta-carotene was a good example where that violinist actually, with beta-carotene, actually increased lung cancer mortality in smokers. And Mother Nature, the ensemble, has put that together, and we're still trying to derail and still learn about this. So beware of marketing from science, and the science has changed right now. So that's how I feel about this area. Stuart, do you want to say anything more about that, or are you happy with that?
No, I think I'm very happy with that. I think if I couldn't even add anything, I would just be echoing the sentiments of yourself and Aditi. I think it's really important to recognize that in most cases, vitamins shouldn't be a substitute for, or pretty much in all cases, shouldn't be a substitute for a healthy diet, getting your micro and macronutrients naturally through diet, also relying on appropriate and timely medications and good physical activity as well. Balanced lifestyle is really crucial. As we saw, many vitamins perhaps have a neutral impact, but there are also some that can have adverse impacts on your overall health. There's a lot of research into this area. It's, of course, still developing. Of course, with, for example, the conversation regarding fish oils. Many of us maybe thought in the past fish oils over the counter were having protective cardiovascular, was protective for cardiovascular events, but of course, recently we find out that really the only benefit would be through pure EPA, IPA with Visipa. So Aditi did a great job as well, recognizing that there is a lot of bias in regards to research surrounding this topic. And so putting on your critical thinking lens and being a little bit doubtful of sometimes what you always hear, doing your own research and relying on the people who've dedicated their life and craft to this sort of area, such as Dr. Curnew or other healthcare providers, is really going to be your best resource when it comes to whether or not you should be taking supplements and how much supplements you should be taking.
I see Rachel Liu on this, who joined us. Rachel, I remember a number of years ago started a thing called our Broad Project, where we're trying to get people to eat more real whole food, probably plant-based eating. And I remember her turning blue in the face and red in the face, where all the patients wanted to take supplements instead of eating real food and things of that nature. So I'll get her to comment at some point in time. And she made me aware of this many, many years ago, is that we have to do what's right, not what's best. I'm sorry, to do what's right, not what's easiest. And best is not always the easiest. It takes a lot of hard work. I remember that picture of the Canadian hockey team, the women's hockey team. They did the right thing. They played in a 95 mask. They kept their bubbles. They're vaccinated. And one of the things is that recall the story of a person dying in the ICU with a vitamin C infusion who didn't get their vaccinations. So you have to make some choices. You have to decide who you're going to believe. I know it's confusing. We live in a polarized world, and think strongly. And there are times that I've been wrong. I at one time gave hormone replacement therapy because it improved LDL cholesterol. I thought it prevented heart attacks. It does cause heart attacks. It causes blood clot formation. I did in the past use a drug called flecainide to help people, but it did more harm than good. I feel bad about that, but I feel bad if I didn't use science to evolve at this point in time. So science has taught me so much. I hope it teaches you too as well, is that science evolved. There's always good discussion, and discussion is discussion, but discussion by experts is much better than people who really have limited ability to understand this. Next slide, please. What we didn't show over here is the slide about the Alzheimer's trial. Do we have that slide anywhere at all, or do we take that out?
The Cosmos Mind, yeah, I think it was a hidden slide. That's why it didn't come up in the presentation, but I can go to it now if you would like to discuss.
We're going to put the Cosmos slide at this point in time. So one of the things is, when you think you know everything, there's still a lot to learn. The Cosmo is a trial that was just released in press form right now. It's a trial part of looking at Alzheimer's disease in the elderly at this point in time. So Cosmos is still an ongoing trial. There is a part that it's a big trial of over 20,000 patients, but they did a sub-trial of about 2,000 patients. Do you want to talk about that, Aditi?
Yeah, for sure. So it's been kind of recently reported on a couple of news outlets, as it is a fairly recent trial with some results that have come out in the past year and then results coming out this year. So on the right, there's just an article from NBC that was kind of talking about some of the results of the trial and whether a daily multivitamin could help slow cognitive decline. So this trial was conducted by a partnership between the NIH, so the National Institute of Health, the chocolate industry, and the vitamin industry. So essentially what they noted from previous studies is that essential nutrient deficiencies, so things like B12 and folate, have been linked to cognitive decline. There have been few randomized controlled trials in this area that kind of assess the efficacy of a multivitamin. So as a result, the Cosmos Mind trial decided to include a cohort of 2,262 individuals, all above the age of 65. So they conducted cognitive assessments before randomizing the participants. And then they had a study to kind of validate their telephone interview method for doing cognitive assessments. And that's how they measured the outcome. So they looked at episodic memory and executive function. And what they found is that the group that was randomized to vitamins did better than the placebo. There's also a subgroup that had cardiac conditions who also showed better benefits with the multivitamin. There is another component to this where they're looking at dark chocolate, and that trial is still ongoing. The results are actually expected to be released in 2022. So hopefully we will be able to hear about the results from this trial soon. Just an important thing that I wanted to point out, because it's a trial that involves multiple parties being involved, there are parties that may benefit from the results of the trial. And that's always something to look at when you're looking at various research sources, kind of looking at their acknowledgements and declaration section and seeing who's involved with the actual research. The best research comes from third-party sources who aren't necessarily connected to the product as a whole, and who therefore don't have as much of a stake in what the results are going to show.
So as we talked about right now, is that this trial is exciting. This reminds me of the beginnings of something. I'm at the point right now in my life is that Mother Nature has evolved over millions of years, and I'm trying to get away from processed foods. So the question, should I take a men over the age of 50, a vitamin supplementation The answer is not yet. I'm going to apply, and I'm going, and Didi and others have taught me so much the power of food. Rachel started that process many years ago, and we've taken away right now. So right now, I'm going to try to get as much as my health benefits from food, because we still don't know a lot. If you go back to that symphony slide, is that we understand it's a summation of all that's important and how they're all connected. We don't know how they're all connected. And if you try to tease out individuals, should I eat egg, should I eat dairy, THMOs of food, it gives us a headache. I want that symphony playing in the background with the multiple team members involved in this. And some of the team members, I don't even know them at this point in time when it comes to food. So what I did learn that pure EPA at 4,000 milligrams a day can have value. If you're deficient of vitamins, you need to have supplements. But if you have adequate levels right now, without a shadow of doubt, is that we have 3 large randomized controlled trials that show is after a certain level of vitamin D, you don't get added benefit. And I'm really trying to sort out science from marketing, and it's an evolving concept, and get different opinions from different people. But beware is that most physicians' vested interest is in you. They want the best for you. And so take that as an independent partnership, which you like. And so I'm really excited about the power of food and what you can do about this. What we didn't show here is that your diet, it's a composition of all the above, or your symphony of your healthcare team is a combination of micro and macronutrients. And just think about how you're going to put that all together right now. So I'm really excited about the power of food, the power of lifestyle changes. If you have sugar diabetes, losing 30 pounds can put your diabetes into remission. A hard thing to do. That by exercising like the Canadian Olympic team every day, you can actually improve immunity. What we learned right now is having any infection from pneumococcal pneumonia, bacterial infection, influenza, now COVID, damages vessels. It leads to more Alzheimer's disease. It accelerates heart disease, accelerates stroke. So basically be healthy and get healthier, and go back to hard work through lifestyle changes. The shortcut about vitamins and most of the time has led to a poor safety mechanism. But the Cosmo trial just raises the bar, is that we have a lot to learn. I'm hopeful that as my mind gets older, taking a supplement or cocktail that will help delay Alzheimer's disease. I'm not so sure 2,000 patients plus is enough to change behavior at this point in time. The answer is not yet. But keep your eyes open and science will change. And I want to thank the entire team for putting this all together. A wonderful thing to do. I'm just going to ask Rachel if she wants to give her comments. Rachel, you've been around for a while. What's your thoughts? What's your take on all this?
I think when you were talking about how different organizations and societies have different numbers in terms of reference values, normal ranges, I found that interesting, because after 1 year of being in various different clinics in the hospitals during clerkship, I've learned that a good doctor often don't just follow the numbers. They don't treat the number, they treat the patient. And I think you can apply that to supplements as well. So most of the supplements, if a doctor recommends it, it's because you're having some kind of problem that may be related to having a deficiency. If you're feeling well and you're going on with your daily life with no problem, I don't think any doctor is going to recommend, oh, just take vitamin D. You might be deficient. You probably is deficient. You probably are deficient because you're living in Canada. But if you're experiencing symptoms like you're feeling fatigue, you're feeling maybe a little bit of depression, you're feeling, not so much energy, then at that point, I feel like some doctors, I think many family doctors at that point might recommend, oh, maybe you can take some vitamin D. Maybe you're deficient in that vitamin D. And that's because right now it's causing you a problem. That's when we would recommend that you can try supplements. And I think that's a trend I've seen in a lot of the specialties that I've rotated through, that if you're not having problems, generally, even if you might be deficient, there's no need for you to do anything about it, to take extra supplements, just go on with your life because it's not causing you problems. Why do you have to do things about it? So I found that very interesting. I also found that throughout the rotations, there's very few cases where supplements are indicated. They're recommended as a possible solution sometimes, but whereas it's like absolutely indicated or we know it will work, it's very, very few cases. And that includes things like vitamin D supplementation if you're breastfeeding your baby to prevent rickets disease. That's one of the very few cases. Or if you are an alcoholic and you constantly on a chronic basis, you don't take in food and most of your calorie is made of alcohol, then you are severely deficient in folic acid, in thiamine, and that can cause encephalopathy. So yeah, we would recommend definitely get those via encephalopathy, but that's a very select few. I don't think most people listening to this seminar or even most of the population would fit into that category. So then it's not really an indication that's relevant to them. Even like things that we hear of calcium and vitamin supplementation in osteoporosis, it's still a weak recommendation technically, because it's not that much strong of evidence showing that it actually does work. The physiology makes sense, but the evidence isn't quite there. There's more evidence for actual drugs that your doctors will recommend if you actually want to protect your bones and you have osteoporosis. If you have normal bones, the best way to maintain them is actually just eat well and exercise. Work those bones and they will maintain themselves.
So exercise is probably one of the best treatments for osteoporosis, maintaining your bone health. And so taking supplements instead of exercise is not the solution for most of us. Well said. The problem is I'm not sure, what we learned right now, the last 2 years, we have 3 big randomized control trials with vitamin D. Once you get to a certain level, we can argue what that certain level is, but we got a good understanding. Taking more adds no value to your health. And that's evolving. Now, I'm interested in what Cosmos has to say in other trials as time goes out. I'm going to be a little bit skeptical because vitamin E was a great story of 1,000 patients that got vitamin E and 1,000 that did not show a reduction in heart disease by 50%. But as time went on, we have over 250,000 people randomized showing absolutely nothing. So we learn and we'll keep learning. And so rely on the people that can give you the best information. If you go to the vitamin store, they're going to tell you to sell vitamins. If you go to the Ford place, they're going to tell you to buy a Ford. So I'm not saying that these are bad cars or bad ideas, but they have a vested interest. And basically find people who give you good information. So I think that's well said. Thank you for sharing that. Any comments or thoughts from anybody else?
I do have a few questions, Dr. Curnew, which I'd love to run by you. This was from one of our participants in the chat. The first question that they asked was, maybe who's the best person to go to when it comes to having a good background knowledge regarding prescribing vitamins and supplements? Is it a family doctor? Is it specialists? Can dietitians be involved in this conversation? Who's the best person to go to when it comes to this type of thing?
So there's the Ontario Dietitians Association. They have a website. They have a number. These are trained dietitians. There's people that have different degrees, and you want to see a registered dietitian. Okay, a registered dietitian, not somebody who has some sort of degree in something that you can get online or take a small course or whatever. Anybody who wants to sell you something, I'm not so sure their information is reliable. If someone says, so I think you want to get a place who gives you an unbiased opinion, and those are so-called experts. I've been thinking about diet for a long time, and I'm confused. But I'll say is that I'm less confused than I were 10 years ago. I got the chance to work with you, Rachel, Aditi, and others who really helped me formulate my opinion based on, I like the slides about, fruits and vegetables. I like the idea is that, the average, a Canadian born today has a 50% chance of developing type 2 diabetes. And that has to change. And basically, eating whole, real, non-processed food, fruits and vegetables, whole grains, more plant-based eating should be the norm. And it doesn't mean you can't have meat. It doesn't mean you can't have fish. It doesn't mean you can't have dairy. It doesn't mean you can't have eggs. Some people feel totally alien to those sorts of things. I do think is that the healthier foods that you eat, most of the time, the better off you are. And 75% plus of Canadians are relying on vitamins and supplements instead of relying on whole, real food. So that's the basics. The foundation of good health is lifestyle changes, trying to get a body mass index between 20 to 25. I think getting a vitamin D level, if you think you have a problem, get it. If you're worried about B12, you should get it. If you're worried about iron, we can give a series of tests, and we can come up to a reasonable answer at this point in time. But relying on supplements, what most of us led to do, is not working. So there we are, real food. So I think is listening to people that are real experts in the area, a good dietitian, a registered dietitian, or a real physician that is really can understand the value of traditional medications and non-traditional medications. I worry about people who just say all or none. You know, the porridge is too hot or too cold or just right. Try to get that right porridge for you. And porridge is a good, healthy food, as long as you don't add too many bad things to it.
Great. If I can also just harp on another question.
And one thing I'll just mention too as well, look at the videos that we have created. We have about 15 videos that you should look through them. I think that will give you a tremendous foundation from triglycerides. We're doing this Sunday, we're going to talk about cholesterol and what to eat. We have so much good information in there. Start there is a good starting point. You have to go back and look at this video a couple times and think about it and stop and start. This is a good foundational start for you.
One thing is, we talked about fish oils. We discussed over the counter. They don't have the benefits that maybe we thought, but we did talk about Visipa, showing the impact it can have at reducing cardiovascular events. One of the participants asks, who do you go to in regards to prescribing Visipa? Is it a specialist? Do you speak with your family doctor? Who should they connect with if this is something that they're interested in?
So Visipa was tested in people that in their 40s, 50s plus, either had heart disease, had diabetes, and a triglyceride around the 2 range or thereabouts. That's where it shows value. It was tested in Japan many years ago in a more broad population. That's a discussion you have to find out someone who's expert on the matter. Not too many people know enough about this right now. I'm leaning towards Visipa as being a very good agent, but I think it's overpriced at this point in time. And so unless you're very rich or have a very rich insurance plan, it's not the job for the average person. And so the government hasn't paid for it, and its pricing level, they will not pay for it. So and so there'll be some secret negotiation and things of that nature. So I'd be glad to give my 2 cents. You can talk to your family doctor who may or may not know about this. Naturopaths will have no idea what we're talking about. And most dietitians don't really understand the pharmacologically of Visipa, how it works. So you get the conversation for a number of people. So what I'm doing is I'm eating flax, chia seeds, having salmon at this point in time. Right now in Canada, you cannot order a pure EPA level to find out where we get right now. So, and we're still learning. There's if you have atrial fibrillation, we have to talk about whether or not that's worth it, because Visipa, all fish oils, will increase your risk of atrial fibrillation. So I'll give you my 2 cents. Look at our webinar on that as well. Stuart, if you can just put that in the put it in a section there where people can get to that. We'll talk more about that. Yeah. It's an evolving concept. We're still learning, and the final answer is still not out.
Mm-hmm. And speaking of other webinars, just the last question here. We know that the government right now is running a pilot project for individuals who are getting their blood tests to get their Lp(a) tested, as well as their BNP and pro-BNPs until the end of March. One question we do have here is, how about lipoprotein A They were just asking, what do you do? What do you do if it's too high? Is this something that you can manage? This
Yeah.
is a topic that we discussed a few weeks ago, and we did do a really extensive webinar on it. But Dr. Curnew, is LP(a) something you can control or manage, or is it mostly a genetic score which is unchanged?
Yeah, so basically 20 to 30% of Canadians have a high LP(a). 90% of it is under genetic control. And so basically every Canadian should have an LP level done once in their lifetime, just once. I've had mine done 3 or 4 times. It's ridiculous. I don't need to repeat it ever again. I have a high LP(a). My son has a high LP(a) level. We're treating our cholesterol much more aggressively because it increases the risk of heart disease between 2 and 4-fold. We have ongoing trials right now that are looking at reducing it by 80% through different maneuvers, and they're done with messenger RNA technology to look at that. That answer will probably be available around 2025, so we still have a long way to go. But right now, if your LP level is high, we treat your cholesterol, you get your LDL cholesterol to lower values at this point in time. Please look at that webinar. We can measure ApoB right now. I don't need to measure ApoB. They're remnant particles. I know what to do about that. There's something called proBNP. It's a marker for pressure inside the heart. Take a look at that. And if you think you fit in those categories, call the clinic or send in the form about looking at that, and we'll decide together whether or not that's worthwhile to you. This webinars are designed to give you generalized opinions. For individual opinions, talk to people who know what they're talking about. I know a lot about very little, and I can help in that areas. There are certain things I have no idea what to say. I have an opinion, but it's not worth it. I've been thinking about this for over 30 years, so I can tell you what I think, and you don't have to believe what I have to say. But at least I can tell you the best I can at this point in time. I probably know a lot more than the average individual, and that's the sad part right now. We live in a polarized world, and is that it's too bad. Is that I hope we get back to our senses at this point in time. I rely on experts in so many areas. I hope you do too as well.
Great. Dr. Curnew, any closing remarks before we call it an evening?
I think we've gone through remarkable evolution in nutrition. Nutrition is very difficult to analyze at some point in time because a lot of the information is based on observational data. Randomized controlled trials are well suited for drugs and procedures. They're not as well suited for observational data. I belong to the UK vegetarian group. I listened to all these other people. I learned a lot from them. But I sometimes feel that some people are just too strong. I don't think you're going to save the world or save your health with just healthy eating. I think it's a stepping stone. Exercise is wonderful, but using the right combination of medications and procedures are important. I think of physicians as 3 phases. Physicians usually deal with situations in crisis. We learn how to deal with that. I think a better physician learns how to prevent disease. And finally, a very good physician helps you end your life in a better way. So the 3 phases of physicians, you can see them in crisis, you can see them in prevention, or you can see how to make your last part of your life as comfortable as you possibly can. Use that well, and ignoring problems don't solve problems. Deal with them. And we have a series of over 200 videos at this point in time. Yeah, they're long, but they're good. Take a look at them, absorb them, then ask questions afterwards.
Great. Well, thank you so much, everyone, for joining us tonight. If you ever do have any questions, Aditi, if we can just go to the next slide here, you're always welcome to send us an email at drcurnew232@gmail.com. And of course, if you'd like to find any of our other YouTube videos, again, as Dr. Curnew mentioned, we have over 200. If you just type in Greg Curnew or Dr. Curnew into your YouTube search bar, you'll be able to find all of the videos that we have available. And we come up with 1 to 2 videos every single week as well. So there's always going to be new information to enjoy. Thank you so much.
And I'm very grateful for all the hard work of so many people to put this together. We keep saying we're trying to be less than an hour. Maybe we'll get to that point. We'll keep working at this, but there's so much good information. I want to have a special thanks to all our patients, all the staff that our staff who've been through so much the last couple of years, they're tired. We're tired. And we want to get people healthier. So right now, this pandemic hasn't gone away. It's not time to let down our guards. Use proper techniques of isolation and protection. Vaccines are part of the solution. The vaccines will evolve. We live in a country that gives us a choice about to refuse a vaccine, but we also give a choice that we allow people to harm other people as well. So you have to decide what you're going to do at this point in time. I'm quite impressed that diet, lifestyle changes are foundations to health. And I'm so wonderfully proud of the Canadian women's Olympic hockey team. Those are good Canadians. There's lots of good Canadians out there, different opinions. I'm not saying the people in Ottawa don't have points, but bringing across points that can hurt other people is not the way, the best interest. So make your point, good conversations, good information, use science whenever you can, and good discussions right now. And thank you all for participating. Thank you all for listening, and have a wonderful night.
Take care, everyone.